Top 7 symptoms of sore throat. Today, we're tackling a common health issue that many of us have experienced, the sore throat. Have you ever woken up with that scratchy, uncomfortable feeling in your throat? That's what we're here to talk about today. A sore throat, also known as pharyngitis, is characterized by pain, scratchiness, or irritation in the throat. It can make swallowing, talking, and even breathing uncomfortable. Sore throats can be caused by various factors, including viral infections like the common cold or flu, bacterial infections such as strep throat, allergies, environmental irritants, and even acid reflux. Throughout this video, we'll delve into the different causes of sore throats, how to identify them, and most importantly, how to find relief. So, if you've ever wondered why your throat feels so irritated, stick around as we unravel the mysteries behind sore throats and explore ways to soothe them. Let's dive in. Number 1. Viral infections. Viral infections, including the common cold and influenza, often manifest with a sore throat as one of their primary symptoms. This discomfort typically accompanies a range of respiratory symptoms such as coughing, sneezing, and nasal congestion. The onset of a viral sore throat is often gradual, starting with mild irritation and progressing to more pronounced discomfort over the course of a few days. Alongside throat soreness, individuals may experience fatigue, body aches, and a general sense of malaise as the immune system fights off the infection. While viral, sore throats are usually self-limiting and resolve within a week or so. They can be particularly bothersome and affect daily activities. Rest, hydration, and over-the-counter remedies for pain relief and symptom management are common approaches to alleviate discomfort. However, if symptoms persist or worsen, consulting a healthcare provider becomes essential to rule out other potential causes and receive appropriate medical guidance. Number 2. Bacterial infections. Bacterial infections, notably streptococcal pharyngitis, commonly known as strep throat, are frequent culprits behind sore throats. Streptococcus bacteria cause inflammation and irritation in the throat, leading to discomfort, difficulty swallowing, and sometimes fever. Unlike viral sore throats, strep throat tends to have a sudden onset and may be accompanied by other specific symptoms like swollen lymph nodes in the neck and white patches on the tonsils. Strep throat is highly contagious and can spread through respiratory droplets, making it important to seek treatment promptly to prevent its transmission. Antibiotics are often prescribed to treat strep throat and prevent potential complications such as rheumatic fever or kidney inflammation. Prompt diagnosis by a healthcare professional through a throat swab test is crucial for distinguishing bacterial from viral sore throats and ensuring appropriate treatment. Failure to treat strep throat adequately can result in prolonged discomfort and may contribute to the spread of the infection within communities. Number 3. Allergies. Allergic reactions to various environmental triggers can lead to throat irritation and soreness. Pollen, dust, pet dander, mold spores, and other allergens can cause the body's immune system to react, resulting in inflammation of the throat tissues. For individuals with allergies, exposure to these triggers can provoke symptoms such as sneezing, runny nose, itchy eyes, and a sore throat. The soreness is often accompanied by other allergy-related symptoms and may vary in intensity depending on the degree of exposure to the allergen. Allergic throat irritation can be particularly bothersome during peak allergy seasons or in environments where allergens are prevalent. Managing allergic sore throat involves identifying and avoiding triggers whenever possible, using antihistamines or nasal sprays to alleviate symptoms, and employing measures like air purifiers or allergen-proof bedding to reduce exposure. Seeking guidance from an allergist can help individuals develop personalized strategies to manage their allergies and minimize throat discomfort. Number 4. Dry air. Dry air, especially prevalent during the winter months or in arid climates, can contribute to throat irritation and soreness. When the air lacks sufficient moisture, it can lead to the drying out of the mucous membranes lining the throat, causing discomfort and inflammation. Breathing dry air for prolonged periods can exacerbate existing throat conditions and make individuals more susceptible to developing sore throats. Additionally, indoor heating systems, which tend to reduce humidity levels, further contribute to the problem. People who live or work in environments with low humidity levels may experience persistent throat dryness and irritation. To alleviate symptoms associated with dry air, using a humidifier to add moisture to the air can be beneficial. Drinking plenty of fluids, especially water, and avoiding excessive caffeine and alcohol consumption can also help keep the throat hydrated. Using saline nasal sprays or gargling with warm salt water may provide temporary relief for sore throats caused by dry air. Number 5. Environmental irritants. Environmental irritants such as smoke, pollution, chemicals, and strong odors can provoke throat irritation and soreness. Prolonged exposure to these irritants can lead to inflammation of the throat tissues, causing discomfort and a scratchy sensation. Smoke from cigarettes, cigars, or wood-burning fires contains particulate matter and toxic chemicals that can irritate the throat and exacerbate respiratory conditions. Similarly, exposure to air pollution, whether from vehicle emissions, industrial activities, or natural sources, can have adverse effects on throat health. Chemical irritants found in household cleaners, paint fumes, and certain workplace environments can also contribute to throat irritation when inhaled. Strong odors, perfumes, and allergens can trigger throat sensitivity in susceptible individuals. Minimizing exposure to these environmental irritants whenever possible. Using protective measures such as masks or respirators in polluted areas. And ensuring adequate ventilation indoors can help reduce the risk of throat irritation and discomfort. Seeking medical advice if symptoms persist or worsen is important to address underlying causes and prevent potential complications. Number 6. Acid reflux. Throat discomfort can also be linked to acid reflux, a condition where stomach acid flows back into the esophagus. This reflux can lead to irritation and inflammation of the throat tissues, causing a sore throat. Individuals with acid reflux may experience a burning sensation in the chest, heartburn, regurgitation of stomach contents, and difficulty swallowing in addition to throat symptoms. The acidity of stomach contents can be particularly harsh on the delicate throat lining, exacerbating soreness. Lifestyle modifications, such as avoiding spicy or acidic foods, maintaining a healthy weight, and not lying down immediately after eating, can help manage acid reflux and reduce the likelihood of a sore throat. In some cases, medications that reduce stomach acid production or neutralize it may be prescribed. Seeking medical advice is essential for proper diagnosis and to develop an appropriate treatment plan, tailored to the individual's specific condition and symptoms. Persistent or severe symptoms warrant prompt attention to prevent complications like esophagitis or Barrett's esophagus. Number 7. Strain. Excessive strain on the throat muscles from activities like yelling, talking loudly, or singing for extended periods can result in throat soreness and discomfort. The vocal cords and surrounding muscles can become strained and inflamed due to overuse, leading to a sensation of rawness or pain in the throat. Individuals who frequently engage in professions or activities that require heavy use of their voices, such as teachers, singers, or public speakers, are particularly susceptible to this type of sore throat. Resting the voice, staying hydrated by drinking plenty of water, and using techniques to promote vocal health, such as proper breathing and vocal warm-ups, can help prevent throat strain. Limiting exposure to environments with loud background noise and using amplification devices when necessary can also reduce the need for excessive vocal exertion. If throat soreness persists despite rest and self-care measures, seeking evaluation from a healthcare professional, especially one specializing in voice disorders, is advisable to prevent potential vocal cord damage and ensure proper management of symptoms. Summary. In today's video, we delved into the world of sore throats, exploring their causes, symptoms, and management strategies. We learned that sore throats can be triggered by a variety of factors, including viral and bacterial infections, allergies, environmental irritants, and even acid reflux. Identifying the root cause of your sore throat is crucial for effective treatment. Whether it's a common cold, strep throat, or seasonal allergies, understanding the underlying issue can guide your management approach. From rest and hydration to over-the-counter remedies and lifestyle adjustments, there are plenty of ways to alleviate sore throat discomfort and promote healing. Remember, if your sore throat persists or worsens, it's important to seek medical attention to rule out any underlying complications. Thanks for tuning in today. Don't forget to like, share, and subscribe for more health tips and insights. Take care, and we'll see you in the next video.